Exciting and very relevant topic. Um, I'm Dr. Linda Prieto, for those of you who might not know me yet. Chief Program and Advancement Officer with SV2, and I oversee our areas of grant making and immersive learning. And we're so thankful to have all of you on this call with us today, as well as our speakers who will lead a crucial conversation about current poverty policy and its weaknesses, as well as help us understand what happened to the social safety net and the different approaches that are being taken in response to the current moment. So we have Devin Gray, Executive Director of EPIC and Poverty in California, and David Plasterer, Senior Policy Advisor at Results, who will be in conversation with our very own Amy Everitt. But before we transition to the actual conversation, for any friends who are joining us today who are new to our SV2 ecosystem, I do want to share that SV2 is a unique nonprofit consisting of community innovative givers committed to accelerating equity through hands-on and immersive learning in the areas of grant making and social impact investing. And for over 25 years, SV2 has been a trusted social innovation leader for shared learning and action. Our mission is to unleash the resources and talents of the Bay Area community to achieve meaningful social impact. So we invite you to continue to learn more about us if you are new to us. And SV2 again is excited about today's conversation, serving as the first of what will be a multi-part series that we will launch in the fall. So continue to join us as we take a deeper dive into issues of poverty and financial insecurity, both in California and across the US. So let's go to Amy Everitt now, and she is an SV2 donor partner and also the president of Golden State Opportunity. And Golden State Opportunity is also a nonprofit. They are dedicated to ending poverty by providing all Californians with tools to build financial well-being and to thrive. Amy first brought to the SV2 team the idea for today's conversation, and we are so grateful to her for helping us to bring it to all of you. Amy, I will turn it over to you now. Thanks again.
Thank you so much, Linda and Jody. Yeah, I'm super excited that we took an idea and here we are making it happen. And I'm really grateful to everybody who was able to take their time out of your busy schedule to join us today. These are really heady and incredibly timely topics today. So I wanted to just sort of introduce my colleagues who I work with and have an enormous amount of respect and admiration for. First, I want to introduce you all to David Plasterer. He is the Senior Policy Associate at Results, and Results stands for Raise Your Voice to End Poverty. You're going to see a theme in why we have our speakers today. Results is a network of staff and volunteers in all 50 states who advocate in their districts and in DC for dismantling poverty in the US and globally. And just David has actually been in DC for the past 2 days, so it's like ripped from the headlines. And also my partner here in California, Devin Gray, he was the president of EPIC, which stands for Ending Poverty in California. And EPIC aims to end poverty in California by elevating the voices of people experiencing poverty, creating and implementing policies rooted in their needs and advocating as a state agenda focused on equal opportunity for all. So thank you both for joining us today. I know it's a super busy time. So as we begin, I just want to give you all also the same, kind of building on what Linda said. We're going to be answering 3 big questions today. Well, we're going to try to do our best to answer 3 big questions today. Where have we been? Where are we? And where are we going when it comes to policy making related to alleviating and ending poverty? And before we dive in, I'm going to kind of bore you all, but it's really important that we all start with a baseline and the same level of information about what poverty actually is in America. And so bear with me while I share statistics with you, which is like the wonkiest thing ever, but it'll level set, I hope. Out of a population of 327 million people in the United States are identified as living in poverty. That is 28%. In California, we have 38.2 million people living in our country, in our state, 27% live in poverty. But what does that even mean? Because there's different definitions of it. And this is a really important line for everybody to know. I'm going to be quoting to you the federal poverty measures. federal poverty line. There are a lot of different ways that people measure poverty. You'll hear things like supplemental poverty measure, 200% of FPL, or things like that. The reality is all of those measures only vary by very little. But it is what informs our safety net and who qualifies for what. For myself, I mean, if you want in the chat, write down, put in what you think the poverty level is for an individual. And I will start with what it is for a family. For a family of four in America today, you are living at or below the poverty level if you make $32,150 or less. Jody. For an individual, the number is actually $15,650. So imagine pretty much anywhere in the United States, that is not meeting your basic needs. So when we're talking about poverty at GSO, at Golden State Opportunity, what we like to think about more is like, what does financial security look like? Not just rising above a poverty level, because that doesn't necessarily mean you're in financial security. One last segment of level setting. For those living in poverty, those who have only a high school degree is about 14%. Those who have some college or an AA is at 10%. And those who have a BA is about also 9.6%, 4.6% are living in poverty. But what that number really is like about 4 million people. So it's these numbers when we're talking, they're just huge. And I guess the point I really want to make as I go into my first question to Devin, I want everybody to really understand that poverty impacts everybody in every state. It doesn't matter what the color of your skin is. It almost doesn't matter what kind of education you get. Poverty, everybody can fall into economically difficult times. And most Americans are in a financially struggling. These are just that $15,000, $30,000 level that I was talking about, which isn't enough to begin with. So this is actually a question to David first. I'm sorry, Devin. We have a lot of people struggling financially in America. So what programs and services exist or did 6 months ago that we have been using to address this challenge in America?
Yeah, thanks. Thanks, Amy, and thanks everyone for being here. And Amy, thank you for that level setting. That I actually had a little bit of that prepared to share too, just because the way that you actually measure poverty is so important to our understanding of poverty. Um, and the official poverty measure or the supplemental poverty measure don't really meet the mark of what we need. And I think a big reason that is the case is that it doesn't account for variation in cost of living. And so like the poverty line in California is the same as the poverty line in Indiana where I live. And I can promise you where I live is not as expensive to live. Yeah, so I appreciate that. And so to kind of to answer the question, to talk about, what's available, what's out there right now, we commonly hear it referred to as the social safety net, which I think is actually a helpful way of thinking about it, because you sort of in a net, you have a lot of different threads that are all interconnected to make, to make a net, right? That's meant to sort of catch individuals as their income falls and their situation becomes more precarious. And so some of the strands are healthcare related. This would include programs like Medicaid, which provides health insurance coverage for low-income families, people with disabilities, and seniors. The WIC program, which stands for Women, Infants, and Children, supports the health of mothers and newborns. So there's Social Security disability that also supports Americans with disabilities who are unable to work. And Medicare, which provides healthcare for retirees and some individuals with disabilities. These programs each have different target populations and eligibility requirements, but they're all focused on improving health outcomes. Other strands of our safety net are related to nutrition. The most prominent example of this is the Supplemental Nutrition Assistance Program, or SNAP, which was formerly and perhaps most commonly known as food stamps. SNAP provides families with funds that can only be used to purchase food. And it's sort of like the program of last resort for many families who cannot afford to feed themselves. Also WIC, which I just mentioned, is also a nutrition program providing healthy food for mom and baby. And it's kind of a good example of how these threads connect to each other as they support individuals and families. Some strands are related to housing, right? The Department of Housing and Urban Development, otherwise known as HUD, oversees many federal programs related to housing, such as Section 8 housing and housing choice vouchers. They help make housing more affordable by lowering the cost of rent based off of an individual or family's income. HUD also provides emergency rental assistance to help families avoid eviction and homelessness, and funding to homelessness service providers like shelters, and access to supportive services like in employment, healthcare, and nutrition. And so, again, another good example of how these threads connect together as they support folks. And finally, we have income supports. And the only federal program I know of that provides direct cash assistance to families is TANF, which stands for Temporary Assistance for Needy Families. And it's actually sort of a remnant of the welfare program that existed prior to Bill Clinton's presidency. It's only available to the very, very lowest income families. But there are other income supports that exist in our tax code, such as the Earned Income Tax Credit, which is a refundable tax credit for low-wage workers with little to no tax liability, and the child tax credit, which isn't provided in full to the lowest income families because it's only partially refundable, and has a rather steep phase in that makes it difficult for the lowest income families, or makes it impossible, frankly, for the lowest income families to claim the full credit. But it is provided to families making as much as 400,000 a year. And because of the way that this is set up, currently 17 million kids don't receive the full CTC due to their parents not earning enough in wages. And under the House proposal, this is next, but that's going to go up to 20 million if Congress has its way here potentially today. And so all of these programs and many others make up what is most commonly referred to as our social safety net.
Thank you, Dave, for that sort of big overview of a lot of programs, and a lot of things weren't mentioned. But Devin, so we have all these programs, and yet we still have all these people struggling financially and living at below or near the poverty line. What's going on?
Yeah, so David, thanks for that primer, and Amy, thanks for the tee up. Even to zoom out, when we think about poverty and like how we define it, I think in like layman's terms, it's just people not having enough money in their pockets, right? And we solve that by trying to bridge the gap between the costs that are required to achieve a certain standard of living and the money that people have to be able to meet those costs, right? And the safety net is how we address the latter by, as Amy mentioned, putting money in people's pockets to let them achieve financial security. And as David discussed, we have this robust network of federal and state benefits programs, whether they be income supports or tax credits or subsidies. But there are several ways in which the programs are designed that lead to eligible beneficiaries not getting the help that they need. And that can happen because of the patchwork nature of the programs or other features that just lead to undesirable outcomes for people who are eligible. And to be clear, there are countless challenges, but I'm going to name three that I think are mentioned most often when we're in community across the state talking to folks who are navigating these benefit systems. The first really is that it's just quite complicated to enroll in all of the programs that you might be eligible for. Applicants have to navigate different platforms that require different sets of information to receive benefits from different programs. Some of these programs are administered by the federal government, some are administered by states or counties. And often receiving help from the government to navigate these processes is difficult to come by, to say the least. And so the outcome of this is that applicants who are already resource constrained, both in terms of cash and time, have to spend an inordinate amount of time and sometimes even lost wages to try to get the help that they need. Many in our field describe this as the time tax, because it really is a tax on people's time and ultimately their resources to be able to get the help that they're eligible for. And as a result, we have millions of Americans and hundreds of thousands of Californians not availing themselves of the benefits that they otherwise qualify for. For example, David mentioned the TANF program. In California, our version of TANF is called CalWorks. It's just we get a block grant from the TANF program, we administer it at the state level. Only about 60% of eligible California families are enrolled in CalWorks. That's actually a higher uptake rate than many states, But in our context, it still leaves hundreds of thousands of families on the table not receiving the supports, the direct income supports that they need to feed their families, right? The second challenge is a phenomenon that many of us in the field call the benefits cliff. Many of you will be familiar with the dynamic where an individual on public benefits might experience a small increase in their income only to have a sudden decrease in the public benefits that they receive because they now earn too much to qualify for the money that they previously got. So it puts beneficiaries in a really impossible position where they're having to choose between improving their earned income but ending up worse off, or stalling their present income to maintain their benefits. And it's a real catch-22 that oftentimes leads to people opting for not getting a raise at their job or an increase in the income they get from a job because they know that they're going to come out worse off on the back end. So it leads to bad incentives. And the third challenge is an underlying bias against beneficiaries that so often shapes their experience in navigating all of these systems. And it manifests in a number of ways, from feeling dismissed and unwanted when interacting with the system, both because of personal interactions, but also when the system itself and the technology isn't user friendly, it leads to a lot of burnout, right? I think we've all navigated really difficult customer service interactions, not because people are mean, but just because you have to dial one a bunch of times just sort of make your way through. It's really frustrating, right? So there's that angle, and there's also the structural bias that sees programs like TANF in our CalWorks program here at home have features like work requirements that don't actually lead to increased workforce participation, or even sanctions leveled against participants who fail to adhere to certain program requirements, leaving them actually getting fined, which is kind of crazy when you realize the population that we're talking about. But all of this is really borne out by a bias that tends to assume that applicants are fraudsters or fraudulent until proven otherwise, rather than the other way around. So the bias oftentimes manifests in a lack of customer service that makes it difficult for people to access.
Thank you for that. So we have a system that it's very complicated and very widespread. It's designed with to help a lot of people, but for the reasons that Devin mentioned, it's not. And I think we saw some of this bear out in the election. People are really frustrated with how the government is delivering and supporting folks. Dave, you're in DC. Those, what we just described, are programs that have been around for decades. What is happening now? Literally now.
Yeah, unfortunately, not particularly great things are happening to these programs that, while they suffer from a lot of the faults that, Devin shared, there are still, millions and millions of people who rely on these programs and, people who are able to access them. And so it's critical that we, because of some of the shortcomings, it's critical that we improve them, not cut them, which unfortunately is what is really on the docket in the Congress right now. So the House, what's happening right now is the House of Representatives is voting soon, potentially today, on their what's called a reconciliation bill. And so essentially a reconciliation bill is something that parties typically do when they have won majorities of the House, Senate, and the presidency, but they don't have the 60 votes they need to make official law in the Senate. And so they use this reconciliation process that's pretty convoluted and not very important for the purposes of our discussion today, except to know that it allows them to pass bills in the Senate with just 50 votes. And so it'll be and it's an entirely party line vote on this bill. Or at least it's entirely being drafted by Republicans in Congress. And so I'll give you a short summary, I guess, of what this bill would mean for Americans. But I want to be clear, this is just a short summary, and there's a lot of things that are damaging far beyond the scope of what I'll cover. And I encourage everyone to read, more about anything in this bill that maybe I don't mention today, maybe around preschool, elementary school, secondary education, mental health, immigrant rights and taxation, or reproductive rights. And I'll kind of go through this by committee. And what I mean by that is each committee in Congress has jurisdiction over different programs. And as a part of this bill, each committee wrote their own separate bills about what they want to do to the items under their jurisdiction. And so the three primary programs I'll talk about are the Ways and Means Committee, which covers tax, the Energy and Commerce Committee, which covers Medicaid, and the Agriculture Committee, which covers food assistance programs. So there's a lot of sections to the tax bill, but the ones that what I want to focus on is what we talked about already, which would be the child tax credit and earned income tax credit, which are the two primary things in our tax code that serve families with low incomes whatsoever. And so about the only good thing I can say maybe in this bill is that they increased the child tax credit from $2,000 to $2,500. And so, that's great. Like a lot of families will get an extra $500 for their kids. But the problem is that for the 17 million that I mentioned earlier who don't get the full child tax credit because their earnings are too low. And when I say too low, this would be any family with one child making under about 25,000 and then up to $46,000 if you have four children. So, and then 2 and 3, it just kind of goes up incrementally. And so if you make less than that amount, you're not getting the full CTC. And so for those families, this $500 increase will do nothing whatsoever for them because they already don't earn enough to get it. And so now we're done with all the good parts. Um, they're also adding social security number requirements that both parents have a social security number in order to claim the CTC, which is going to kick about 4.5 million U.S. citizen kids, off of the child tax credit. They are also looking at making the CTC index to inflation, which in theory is good, but it makes it a lot harder to get to an equitable position with the CTC. And I'll explain a little bit more about that. And then they're adding eligibility verification for the earned income tax credit, which means anyone who wants to claim the earned income tax credit before they claim it will have to go in and prove their eligibility and citizenship, like in a very onerous way. Like all the details aren't entirely clear, but it looks like it's like an in-person thing where you have to go in, show like your ID or passport, and like get verified before you can claim it. And so there's going to be a ton of families who just like don't do that and then just miss out on the EITC. And so, this is a huge disappointment to me, I've been working particularly with Republicans in Congress for many years in the CTC, and there's a lot of them who are in a good place on this, and I wish they would have won the day, but they didn't. Like I said, it does nothing for the 17 million kids who don't get it, and it actually increases that amount to 20 million because now that it's $2,500, the amount that families have to earn goes even higher. And so, um, like I said, it's a big blow to efforts to improve the CTC, but there's a couple senators that we really are hoping will be vocal and push for improvements in the Senate, including Senators Josh Hawley from Missouri, Jim Banks from Indiana, Katie Britt from Alabama, and Roger Marshall from Kansas, and Mark Wayne Mullen from Oklahoma. I would add Bill Cassidy in Louisiana on that. So that's part of what we're doing now to build up that support. And Energy and Commerce, which covers Medicaid, they're adding work requirements to Medicaid, which, in case anyone's familiar with Arkansas, Arkansas did this, a handful of years ago, and the effects were just devastating. And, just so many people lost coverage, people who should have been eligible, because, and this goes back to Devin's points earlier about the high burden of proving eligibility. And so when you do these work requirements, it's like people are working, but for one reason or another, don't get the right report into the right person, and then they get cut off from Medicaid. And then further, they make it so that if you get kicked off of Medicaid for not complying with work requirements, you're also ineligible for health insurance subsidies on the insurance marketplace. So it's like you can't have Medicaid and you can't even buy your own health insurance now. It makes changes to what's called the Medicaid provider tax, which is sort of like a funding mechanism that a lot of states use, and particularly for rural hospitals, which are under great financial strain because of how many of their clients like rely on Medicaid. And so the changes in the provider taxes will likely cause a lot of rural hospitals to shut down. And then they have one that just all it does is just increase the eligibility verification. Like my mom's on Medicaid, and she came to DC with me this week, and we talked with her member of Congress and explained this, how like, once a year she has to requalify for Medicaid. Well, they want to make that twice a year now. And my mom was like, it already takes me like 2 months to prove my eligibility, like the one time a year that I have to do it. And now it's like, that's like, she's like, as soon as I finish that, I'm going to have to start proving for the next 6 months. And it's really strenuous. And she has, a policy, a policy associate, as her son to help her through it. So imagine folks who don't have that kind of support system and what they go through. And then lastly, the Ag Committee is really going to harm SNAP and in certain states, particular like my state of Indiana. But what they're doing is, SNAP is 100% federally funded as it is, and they are going to implement a cost sharing program based off of a weird formula that they've come up with. And it will cause some states like mine to pay as much as 25% of their SNAP costs, which, because most states have balanced budget amendments and can't run deficits like the federal government does, I know in Indiana it's a cut of $3.8 billion. And I will get the numbers for California and put them in the chat when I'm done talking. But it will be a huge increase to your state budget if they push the costs onto the state. And then they are increasing the already very strict work requirements, um, which currently end at age 54. They're going to push that up to 64. And for the first time federally, work requirements will apply to families with children. Families with children were always exempted because, I guess they figured, you have kids and we just want to make sure you and your kids have food. Well, now your kid only counts if they are under the age of 7. And it also freezes any future benefit increases as a part of the Thrifty Food Plan. Um, and so, while while these bills are really bad, um, some of the worst policy ideas didn't make it through. And so like that's positive. They didn't make like major cuts to the EITC or head of household filing status or child independent care tax credit. They didn't put sort of per capita caps on Medicaid expenditures to states. Um, and I know that like doesn't mean much, but I think it's a testament to how impactful grassroots and grass tops advocacy is, because those changes are being sought by a number of members of Congress right now. But so far, those members have been rebuffed, and in part due to the pushback that advocates are generating.
Thank you so much, David. So we have a system that was helping a lot of people a little bit. And it sounds like some of the challenges that Devin outlined, that time tax, having to like requalify for Medicaid twice a year, the bias is like this assumption that people are trying to commit fraud rather than this assumption that people are trying to feed their families. And the punitive nature of it really lands us in a place where, kind of, we're going to get to the next question, which is what are we going to do next? But Devin, I wanted to turn to you before we start really focusing on after the brush fire that we are seeing. And I want to say one thing. So the reconciliation bill, I think that advocates are doing a really phenomenal job on pushing back, especially on the Medicaid. That's where I hold my hope, is that we're going to be able to hold some sort of line there. But a lot of it's going to happen because the people who would normally be able to stop this are not in any position to stop this. This is what 3-house rule by one party can do. Democrats did it at one point. Republicans are doing it now. So this is the likelihood of all this actually happening is really high. Devin, what do you think the impact is going to be on California and the work that we do here?
Oh, it's tremendous, right? I mean, I think as David mentioned, SNAP is entirely federally funded, right? So the outcome for states is that we have a choice to make where we either constrain the amount that we're able to provide to folks by dipping into our own reserves, or we let people fall off of the programs entirely. And like David mentioned, states, including California, we have balanced budget amendments. We can't run a deficit. And so cuts to programs that where we rely heavily on federal funding mean that we have a gigantic hole blown into our budget. And that's even with the fiscal challenges that California is currently experiencing. We just saw last week that the governor's budget proposal came out with huge cuts to our Medicaid program here in California. And it's only going to be exacerbated by cuts to programs like CalFresh, which is our SNAP program, and Medi-Cal, which is our Medicaid program. So it's severe.
Yeah. I mean, and some of the things that going back to some of the things that David was saying that I want to tease out are some of the ironies. I mean,
Yeah.
child tax credit doesn't even help the poorest families.
Yeah.
I mean, that ever since I've got involved in this in anti-poverty work, that has always blown my mind. For those who want some good news, the California earned income tax credit that we have here is designed specifically to help the lowest income people. So there are some like small backstops, but the difference between California programs and federal programs is a magnitude of thousands and thousands of dollars. California just can't do what the federal government does. So and I also want to point out, especially with the Medicaid and the new work requirements going up for seniors, the fastest growing block of people moving into poverty are seniors, specifically senior women, but all seniors. It's the fastest growing group moving into poverty. And now we're going to be like exacerbating that even more. So the way that I look at things is we're going to like fight like hell right now to save what we can. But as I said, with reconciliation, we don't have a lot of options. So a lot of these programs that so many millions of people have relied on, whether they're great or not great, they are relied upon, are going to be gone or so dramatically changed that fewer people are going to be able to engage with them. So, and this is the hope part of our conversation, just FYI. After everything, after this brush fire that goes through the federal government, and it's not just on poverty policies, it's on everything. I mean, the depth and the breadth and every other way of looking at something that's being impacted. It's really amazing. What should we as advocates and as donors and as people who care about these issues, what should we be planning for? Like after everything is said and done, when the opportunity comes back, which I believe that it will, what do we want to advocate for? What are 21st century solutions that address some of the challenges that the previous programs had? Where do we go from here? And I'm going to leave it to David or Devin, who wants to take this one first.
Yeah, I'm happy to jump in. Yeah, I think there are a few things that we can do at the state level now that can be hopefully replicated at the federal level next time that there's a sympathetic government for these types of programs. And these are things that we actually have a fair body of evidence to support are really effective anti-poverty measures. I think the general like disposition that I have towards these things is removing the filters that exist between someone who needs cash assistance and that person receiving cash assistance. We talked a lot about the time tax and the benefits cliff and the biases that exist in the system. If we're able to remove some of those barriers in the bureaucracy that can oftentimes lead to people falling off as they're going through an application, we're going to see more money in people's pockets, and as a result, less poverty, which is great. I think the first example of us seeing this play out in practice is guaranteed income, where recipients consistently receive money directly with no strings attached. My organization was founded by a guy named Michael Tubbs, who was the former mayor of Stockton, California. During his time, he ushered in the first mayor-led guaranteed income pilot. This was back in 2018, where 125 low-income residents of Stockton received around $500 a month for 2 years. There were clear impacts on both the short-term and long-term earnings of people, better health outcomes, and people spent the money in the ways that any of us would on groceries, utilities, school supplies, food for their kids. And these pilots have been replicated many dozens of times over across California and across the nation, even across the world. And we've seen consistently really strong results for people who are beneficiaries of these pilots. I think step 2 for this, of course, is thinking about how we transition from pilots to policy. How do we take the lessons of guaranteed income and implement them into the existing safety net that we have, where those values are able to emerge? Those values being ease of access, not being paternalistic on how people spend the money, reliability, predictability with how your income changing might lead to differences in the benefit that you receive. But I think we can actually introduce a lot of reforms to our existing programs to better reflect the values that are espoused by guaranteed income. But it's going to require some steps around streamlining the programs to increase ease of access, making sure that there's no wrong door for you to be able to receive the help that you need, removing the needless barriers to entry, and of course, lifting restrictions on how people can use the funds, because we've seen time and time again from direct cash programs that people spend the funds in ways that we would deem as responsible, but I think it's quite predictable because ultimately the way that people spend the money is the way any of us would. The good news, I think, to build on this is, like David and Amy had mentioned, we've seen some versions of this at the federal level that have had tremendous success. I think most notably, though not perfect, the expanded child tax credit from 2021, which was in a way kind of a form of guaranteed income that saw families with children receive anywhere from, at least during this year in 2021, $3,000 to $3,600 per child, no strings attached. And again, people spent the money in the ways that any of us would. And of course, didn't reach everyone, but the effects were amazing. Maybe one of the greatest anti-poverty actions since LBJ's Great Society, where we saw record lows of poverty overall and a child poverty rate that was cut in half within a year. Really, really big stuff. Unfortunately, that expanded version of the program didn't last after Senate Republicans, frankly, killed the program the following year. And unfortunately, we saw in 2022 the single largest one-year increase in poverty in American history. And in California, we saw a child poverty rate rise from 7.5% to nearly 17%. So the rolling back of the expanded CTC during the first years of the Biden administration had really bad effects. But the point is that we know that expanding both access and the size of the award for the child tax credit does have a really meaningful impact for middle class and working class families. So that means that we can replicate it next time that there is a sympathetic government in power. We can actually do more than what Republicans are proposing right now in the reconciliation bill.
Great. Thank you. I mean, GI is this guaranteed income. GI, guaranteed income, is one of those ideas that a lot of people have. I do see, before I move to you, David, I want to address Catherine has a bunch of questions in here. And I actually think that there's one answer to all of them. A lot of them deal with, cash programs work, but, what about the prevailing perception that giving people cash without strings is unfair and counterproductive? What about, we'll get to the welfare Medicaid one, but also about like work requirements. Why does that make sense? Blah, blah. I mean, my answer to these questions, David, Devin, look in the chat, read them in more detail, see what your response is what I have encountered in the time that I've been working in the anti-poverty space, which is about 5.5 years now, is that there is the mythologies about who is poor and why and what works to solve poverty are outdated for the most part and terribly wrong in many ways. And one of the projects that I'm working on actually with Devin and some others is a narrative change. We need to change the narrative about how people are thinking about this. Right now, we're dealing with a society that believes what they have been told for decades. It's a zero-sum game. If somebody gets something, somebody else loses something. We're not living in, and I don't mean to quote Ezra Klein, in the same way Sheryl Sandberg ruined lean in for me, he's ruined abundance for me, but we need kind of an abundance mindset in terms of when all boats rise, all boats rise. We can all be in this together. And I think that is the number one issue, is because we've always had the data and the research on our side. But when we try and put that out there, we just found too wonky or too something. We have not nailed it because we're not dealing with people's emotional approach to it. And we need to keep people from going back to those like welfare queen tropes that we've been spoon fed for so long. And I think that, we've done a lot of work on that. And I do believe that it doesn't matter if you identify as progressive or conservative. People are very compassionate and they do not want people who are financially struggling to stay there. We're the wealthiest country in the world. We all know we can do better. We just really disagree about what doing better looks like. David, let me pass it over to you about either responding to me, Catherine, Devin, or do you have a different idea of what we could be looking for into the future? What is our 21st century solution to poverty in America?
Yeah, I couldn't agree more with you, and the comments in the chat about the perceptions. And on the child tax credit, and I talked to a lot of Republican members of Congress and their staff, and the perception is always from them that if you're working, then you get the full child tax credit. If you're not working, then you don't deserve it and you shouldn't get it anyway. And then politically, their view is Democrats just only want to give the CTC to people who don't want to work, and we want to give it to people who are working and do deserve it. So it's 100% a deservingness framework of like who and whose children deserve federal investments. Um, and I think that part of the way, at least that I have been working on that narrative, now there's two kinds of narratives, right? There's like the public narrative, which I think is a lot more difficult to change, but very important. And there's a guaranteed income community that has a whole narrative change cohort that's trying to get stories out there about what families are actually facing and works of art and all different types of things. So there's that. My narrative changes more so on the inside game with Congress. And one of the points that Amy mentioned that um, and was a really big lesson learned to me from last year's fight about expanding the child tax credit is that the narrative change that needs to happen is that sometimes even though ending poverty is our end goal, it doesn't always need to be the thing that we lead with and lean into 100% in all of our messaging. Because the thing is that the public don't see themselves in that. If you were to poll people, making under $25,000 a year who are working, many of whom are below the, official poverty line, if you ask them if they were in poverty, they would say no. I work, I'm not in poverty. And so there's something where we can talk about these programs like guaranteed income, like child tax credit, in a more like inclusive way to also like just lower income and even, moderate income families, people I'm thinking in the income range between like 20 and 50,000. And so even though, like I said, our goal is to end poverty and we rightly focus on that, we can still come up with policies that will help that population, but sort of sell it in a way where we are also talking about the benefits to, families who may not be directly under the poverty line. And that is particularly important when we're talking to conservative offices, which at the end of the day, to get anything done in the federal government, in general, and especially to get anything done that lasts long term, it needs to be bipartisan. And so like it cannot be just one side of the aisle that thinks, oh, families working in low wage jobs should get the child tax credit. And so we need to talk like that though, because like that's how like Josh Hawley or my Senator Jim Banks, the way that they talk about CTC is these families are working, they're working hard, they just work in low wage jobs and they're trying to take care of their families. And like that's the kind of messaging that works with Republican members of Congress. And so I think to some extent, the way that we move forward is by building more bipartisan consensus, by being willing to sort of speak to conservative lawmakers in their own sort of language. And I think it's really good for the public messaging too. Because again, I think a lot of families, if they're saying, oh, you only want to expand the child tax credit for families making $10,000 a year. Well, I make, 60, 50,000 a year and I'm raising 4 kids on 50,000 a year, which is not easy to do in very many places. And so kind of like, don't tell me that it doesn't matter if I get a credit too. And so I think that's some of the narrative, work that
You're
needs to be done.
exactly right, Dave. I mean, one of the things that I noticed when we did focus groups with conservatives in California, and one of the things that really came across was like, look, we're working, we're paying our taxes, and we want actually some of these programs to work more for us because we're struggling. The cost of living is going up, insurance is going up, gas is going up, groceries are going up. My wages aren't going up. And I want help too. Like this is something that I think is sort of a national like reconciliation that we need to do is that
Yeah.
this idea of who's deserving needs to be shifted because so many people are financially struggling today. They may not be at the bottom level of poverty. So many people are financially struggling just to make ends meet. And I think John, I think that was your name, asked a question earlier, the cost of living for an individual in the San Francisco Bay Area you need to be making $100,000 to meet your basic needs. If you're living in Arkansas, you need $24,000 to meet your basic needs. But we only have one poverty measure and we have one minimum wage. We haven't even talked about wages here, but we have one federal minimum wage and it hasn't gone up in 20 years and it is $7.25. So if you're working in Arkansas, a full-time job, working minimum wage, you're making $15,000 a year. So you're not at 24,000. Let's say you get the earned income tax credit. You know, let's say that bumps you up get about $2,500 back. You're making $17,000, $18,000. You're still not able to meet basic needs. So we do need to come to some agreements about work, because Americans like work. People want to work and people want to work. So like, how do we leave the knee-jerk reactions, no work requirements at all? And then the more punitive, you have to work until you're 75 and prove it every 2 months that you're doing it. I mean, there is a happy medium, but what we need is a different way of talking about it so people don't do that. Devin, did you want to add something? And then I'm going to go to some of the questions. If you have a question verbally, please raise your hand using the token or put it into the chat.
Yeah, no, I'll be super brief because I think the conversation in the chat's been really robust and interesting. Just to the point on narrative change, we think a lot about the power of storytelling to try to change like the underlying cultural attitudes and norms that lead to policy decisions and sort of dictate the terms of the debate that policymakers have. I think the challenge that we run into is always one of scale, right? Like an individual organization is going to have a very hard time changing cultural norms that have been with us for like centuries, right? Like the bootstraps mythology goes all the way back to like the 1800s and Horatio Alger and the rest. And like, it's not even unique to the American context either, right? So I think that one of the things that I think advocacy organizations with philanthropic partners, I think should be doing, especially in a moment where like robust policy advocacy is oriented more towards playing defense than offense, is can we come together to like collectively tell a better story? And that means like resource sharing and coordination across organizations and issue areas and communities as well, because I think we have to have a broad message. But I do sort of think that a lot of these questions around, changing the narrative around tax cuts or changing the narrative around beneficiaries or whatever it might be, is a place where if we don't address it, we're going to be having the same fights over and over again. But yeah, I just really appreciate the thoughtfulness in the chat because people are asking really good questions.
Totally. Okay, I'm not seeing anybody raising their hand, but we did have another question in the chat. We had two, both from Jody. One was around, and this I'm going to send it over to you, David, which is, the child tax credit was obviously successful in 2021. What was the rationale that people used to not continue it?
Yeah, it's 100% the deservingness narrative, that we're talking about. It's Republicans were unanimously against it. I think, some of that, of course, is also probably politics, where it was just like, it's a thing that the current administration did, and we're against that administration. But I think it's very little that, and in my meetings with Republicans, it's become very clear that the work requirement piece for them is massive. They're just like, the federal government should never give a penny to someone who's not working, unless they are, so obviously disabled in some way. And they will also just say that there's already, I heard this a lot. They would say there's already a social safety net for people experiencing poverty, which of course we've discussed today is not adequate, right? Like, it's important and should be improved, and we don't need to cut it like they're currently talking about doing, or get rid of anything. But it's not sufficient. But Republicans would just say that that's what that's for, and that the child tax credit was always meant to be a middle income tax credit. And so, and technically, it was Republicans who created the child tax credit during the Bush administration, and they're right, like, they did create it, and it was only a middle class tax cut at that time. And gradually over the years, the credit amount has gone up. It went from a non-refundable credit to a refundable credit, and it's been continuously improved in a bipartisan way since the 90s when it was created. And I think that can continue. And so, and part of that is by changing these narratives that led to the 2021 bill failing, around who is working and who is deserving, because most folks are working. I used to work in workforce development at a fatherhood organization, and so I was working with a lot of dads who were coming out of incarceration. I didn't need to incentivize them to work. They wanted to work, but like no one would hire them because they had felonies in their background, unfortunately. And so it's like if you want people to work, and so maybe that's part of the answer too, right? Is provide alternatives. If your concern is that people aren't working enough, the answer to that is not, well, let's take the CTC away from them, let's take their health insurance away, let's take their food away. The answer is let's increase funding for workforce development. Let's reduce barriers to employment, like through maybe enhanced transportation assistance, which is a huge problem for low-income families in order to maintain stable employment. Do better on housing assistance because it's very hard to work from a homeless shelter. I've worked with a lot of guys who have done it, and you can do it, but it is very hard, and very few people are successful at that on the long term. So I think providing those alternatives will help.
Right. Well, thank you. So we have just a few minutes left, and I do want to maintain a reputation for ending right on time. So I want to just extend a thank you to Devin and David for sharing all of your wisdom and experience with us. This has been, I hope it has been really educational. We do also want to make sure that this isn't just let's talk about the challenges that we see, but let's do something about them. David, could you share a call to action? So that we can maybe have some more influence over what's happening in DC?
Yeah, so like I mentioned a little bit in the beginning, the House is voting actually the president went to the Capitol today to say, pass this bill today, put it on the floor and pass it today. So it may be late tonight, but the House will likely at some point pass some version of their bill. There's not a ton of room to still influence that bill. But I was told today by senators, as we were talking about the bill, they said, yeah, we'll wait to see what the House is going to do. We'll wait to see what the House sends over here to us, and then we'll throw it away and we'll write our own bill. And I said, well, that's great to hear because that bill deserves to be in the garbage.
Great.
And
So we
so,
put that information in the chat, a script and where and who to call. Let me just give a second to Devin here. If you have a call to action for people.
Yeah, I'll be super brief. Obviously we have more of a statewide focus as an organization. I think obviously the big fight right now is happening in Congress, but if this does move forward and we think it ends up being as bad as we fear it might be, I think it really is going to be incumbent upon state leaders to ensure that the effects aren't disastrous for Californians. We're a state with immense abundance, not to trigger Amy with that word that has become so fraught, but we are a state with tremendous abundance. We have, the fourth largest economy in the world, and yet it to me is unconscionable that federal cuts to programs like SNAP and Medicaid can't be at least mitigated when it comes to the actual real life impacts for people on the ground here in California. So the call to action really is to try to the extent you can, lobby your representatives in the state house to ensure that they're trying to think creatively about how to plug some of these holes.
And I have a call to action, but mine is a lot more fun. We've been talking about poverty, obviously. If you go to our website, and I believe Linda put this at the top of the chat, but we have a little quiz. And you can test yourself and your knowledge, and it's not all numbers, I assure you. Just to get a sense of what does it really mean to be living in poverty in America in the context of what it's like both in the state and around the world. We are coming to the end. So again, a round of thanks. And thanks to David, Anna, for having SV2, and to Linda and Jody for organizing all of this. I want to just say that we are, this is again, the beginning of a series that we're really hoping to launch in the fall. I hope you will all stay tuned to stay a part of this conversation. We will dive into a lot of different topics. We'll be able to go really deep on some. All of them will have a call to action. If we get it all together, we might even have a summer reading list in preparation for that, but we'll see how that goes. And it's not necessary to do in order to do this, but I just want to thank you all for spending an hour of your time this afternoon with us. Good luck to all of us. Good luck to you, Dave, and to Devin, and the advocacy that we have ahead of us for the next who knows how long. But I want to just pass it back to Jody or Linda if you want to say anything.
Yes, thank you. I'll close this out, mostly with just thanks, especially to David and Devin at such a busy time. David, thank you for being with us while you're also in Washington, D.C., having very important conversations. And Devin, thank you for the really important work you're doing in California. And Amy, thank you for convening us and giving us an opportunity to broaden our thinking and deepen it. And I know I have been reflecting on, like, what can I do? What is my role? How should I think about this? And conversations like this just help us not to feel helpless. So we're really appreciative. And we will follow up everyone with an email with the recording and the suggested script if you wish to call electeds. And we look forward to continuing this conversation in the fall through an ongoing cohort that will dive deeper with reading and discussion. So stay tuned for that. And thank you all so much for being with us today. We really appreciate David, Devin, and Amy. Thank you.
Thank you.
Thanks, everyone.
Take care,
Thanks, everyone.
everyone.